Hey everyone, this is Dr. Garen Weiberg, Doctor of Physical Therapy and Board Certified Sports Specialist. And I'm going to tell you in the next couple minutes how to know if you injured your meniscus. So there's a collection of findings called the Meniscal Composite score. And if you have 5 or more of these, then there's a pretty darn good chance that you injured your meniscus. So typically, not always, but typically when you injure your meniscus, there's a specific mechanism of injury. A moment when you're like, darn, I just hurt myself. Usually that's a misstep, a twist, maybe a deep squat. My brother actually tore his meniscus at work. He just squatted down really low, picked something up, felt something tear in his knee. Now, I'm not saying that squatting deep will tear your meniscus. I squat deep every day. Patients do deep squats. I'm just saying he knew that there was this exact moment where he did something to his knee. And along with that, you might feel a tearing sensation, a pop, something along those lines. Normally, if you do injure your meniscus, you're going to have pain or swelling. It's going to be very rare to have done something to your meniscus and not have pain or swelling. And the swelling is going to be pretty kind of diffuse throughout the whole knee. It's not going to be just in one area. The meniscus is something that sits deep inside the knee, inside the joint capsule. And when you do damage to something like that, the entire knee tends to swell. A lot of people with meniscus tears or injuries report like catching or locking. They're trying to bend and move their knee, but at some point in the motion, they run over this kind of like really sharp point in the motion where it's either just really painful or they actually can't get past that point. And it feels like something is catching or rubbing, or actually in bad cases, depending on the type of tear, the knee joint actually might get locked, like it gets stuck from bending or straightening because the meniscus tear is actually in the way. Which kind of goes along with the next 2 findings, which are pain or difficulty bending and straightening the knee. All right, so let's say that this is the uninjured knee and this is the injured knee. Let's say you can bend your knee pretty darn far on this side, but when you go to bend this knee, it either hurts really bad or you can't get as far, and when you really pull in, it hurts. Now, same thing on the other way. If you try to really straighten your knee, say this side goes really straight, but this side doesn't. It almost feels like you can't get it all the way straight. And when you try to jam it down and really get it straight, it just won't go, or you have really sharp pain. All right, so the joint line is where your femur or your thigh bone meets your shin bone, and it's right here in the middle. You can kind of feel this small gap between the upper bone and the lower bone. And if you have pain along that kind of joint line on either side, that's kind of uniquely tender or painful to this knee compared to the uninjured knee, it's another one of the findings of the Meniscal Composite score. Might as well stay down here because the last finding is something called a McMurray's test, which you can't do on yourself. A doctor or clinician has to do it, but we can kind of replace it with something called a Thessaly test, which you stand up, you bend your knee just a little bit, make sure you're holding on to something, and you're trying to twist through that knee joint. You're gonna go in and out 3 times. If you have sharp pain with that, or clicking or catching, then we would call that a positive test. So, if you have 5 or more of these things, there's a 99% chance that you injured your meniscus. So what this actually means in research terms is that these collection of findings have a 99% specificity, which means if you actually have 5 or more of these things I just talked about, there's only a 1% chance that you don't have a meniscus tear. So it makes sense that you can kind of flip that and say if you do have all 5 of these things, there's a 99% chance that you have your meniscus tear. So I want you to understand something here. It's never just one thing, right? Oh, I have pain bending my knee. I probably have a meniscus tear. Oh, I have pain when I kind of push on that joint line. I probably have a meniscus tear. It is a collection of all of this data, and it has to, again, fit the story. What did the person do to their knee? Most of the time, people don't tear their meniscuses just walking down the street or walking up the steps. Did they have that specific mechanism of injury? Do they have pain or swelling? And then, do they have some of these positive findings? That makes more sense for meniscus tear. Okay, I hope this video was helpful. Please considering liking, sharing, subscribing, and check back. All right, thanks for watching. Bye.